Hello there. Welcome to A to Zig Vaccine. I can take my mask off because I've been vaccinated. I even got a booster. And so it's less likely that I'm going to give you the germs that my vaccine is stopping. So, because I'm vaccinated, there's less likely that you're going to be harmed, and there's less likely that you're going to harm me. But I want to talk about vaccines in general because this is very important. Much of our public health success has come as a result of vaccines. Welcome to A to Zig, and let me tell you a little bit about why it's important to find out the facts. Disinformation and misinformation has been all over the place about the COVID-19 vaccine. And why is this happening? Well, this little image really identifies why it's happening. When a person is not looking for facts, when they are willing to pass a rumor out, even though they haven't checked on it, or they haven't taken the time to go to a trusted source for the information. And let me tell you, there are many sources out there that are not trusted at all. And if you're watching some of those sources on television or listening to them on radio or podcast, you're being misinformed, and then you're repeating that and sharing it with other people. And you're doing a lot of damage with that, unfortunately. The World Health Organization has a source. Here's the link. You can go there. All kinds of information, all kinds of questions. You can go through that. Many of the questions you have will probably be answered. So let's talk about vaccination a little bit. If your children are going to school, they're probably getting vaccinated. When you were a youngster, your mom or grandma or whoever raised you probably took you in to get vaccinated. Vaccines train our immune system to create proteins that fight disease. And we call these things antibodies. This kind of antibody would be created if we were exposed to the disease, but crucially, vaccines work without making us sick. And so it's an easy way to build up those antibodies that you need to avoid becoming sick. And with COVID-19, which is a very, very tough virus, it's good to get vaccinated. So what's the history of vaccines? Well, interestingly enough, we're not new at this. In fact, we know that in the 1500s, China and India were vaccinating people for smallpox. And when Edward Jenner in 1796 was able to create immunity for smallpox, we suddenly discovered the value of vaccination. The first vaccine was created in the laboratory by Louis Pasteur in 1879. It was a vaccine for chicken cholera. When we look at the history of vaccines, we know that most of the vaccines that we have now were developed in the 1930s. Some of them were developed for animals, and some of them were developed for humans. And so, thanks to the success of vaccination, for instance, we haven't had smallpox in the United States since 1949. And it was eradicated in the world in 1980 and declared eliminated by the World Health Assembly. And so, naturally occurring smallpox does not happen anymore because of the vaccination. And the CDC has a list of 17 dangerous and deadly diseases that can all be treated with vaccines. And this is a list of them. There's also vaccines that are recommended when we travel. If you leave the country and travel outside the United States, you may get one of these vaccines. Why do variants take place? Variants take place because people don't get vaccinated. Let me tell you, vaccine manufacturers are constantly changing the vaccine. For instance, Pfizer in Michigan right now is already preparing a vaccine variant that is going to work with the Delta variant of COVID-19 and other variants that are coming along. They're doing it right now, even though we're not going to use it probably until next year. But they're already anticipating these variants and preparing for them. So why do we have to have vaccines? Vaccines protect people. People who are vaccinated are protected. And it breaks this chain of transmission. Remember that we can become a host for a virus and spread it. Animals typically are the source of most of our viral conditions, most of the viral conditions are zoonotic. For instance, the deer population of Michigan has COVID-19. So these things can pass from humans to animals, from animals back to humans. And when we get vaccinated, we break this chain of transmission and we stop the spread. If I'm vaccinated, I'm less likely to give you the virus because I don't have it, or the load that I do have is so small that it's not likely to be something that I'm going to share with you. So we have to think about vaccines as stopping this transmission, breaking the chain of transmission. And so you don't just get vaccinated for yourself, you get vaccinated for everybody else. A virus can spread from an infected person's mouth or nose in small liquid particles, such as we're finding with the airborne COVID-19. And viruses spread mainly between people who are either in close contact with each other or don't wear masks like I was wearing earlier, or are in some way infected and aren't taking precautions such as quarantine so that they don't come in contact with other people. So we know that, for instance, with some viruses like COVID-19, which spreads quite quickly and is a very infectious condition, it doesn't take a big load for people to suddenly find themselves experiencing this. So the virus can only spread in poorly ventilated and in crowded indoor settings. And that's one reason that we've asked people to hold events outdoors where there is ventilation, and why we're opening up windows in schools, because it increases the ventilation, and why we're asking people to clean their hands after they touch surfaces, because it may be contaminated with a virus. I could inadvertently sneeze or spit or pass the virus into a room, and you could touch it, touch your eyes, touch your mouth, touch your nose, and all of a sudden it's in you. So that's one reason that we have to be very clear that people need to practice what we used to call universal precautions. Hand sanitizers, for instance, are very effective at breaking that chain of transmission. Because if there's virus on your hand, if you've picked it up by sanitizing your hands, you're not going to pass it on to somebody else. And if it's on your hands, you're less likely to then pass it on to even yourself. So alcohol-based sanitizers work with COVID-19, for instance. So when we talk about vaccination in this country, the United States of America, we have to be proud of something. We've vaccinated about 67% of the population. And more of the older generation, people 65 and older, have been vaccinated, about 98%. So 53,840,000 and 257 older people, 65 and older, have been vaccinated. And we are also finding that we are vaccinating younger people, 18 and older, 208 million people. And so we're working at getting people vaccinated, but we're still at 67%. Ideally, we should be at 80%, 70% at minimum, but 80%. So we need more people to take the vaccine to stop this transmission, to break the chain of transmission. And once we do that, then we'll be less likely to have to deal with this virus and all the changes that we've had to make in our lives. So if you want more information about vaccines, here's a link to the CDC, which you can go to. The Centers for Disease Control and Prevention puts out information on a daily basis that could be helpful to you. This is fact-based. This isn't a rumor. This isn't some talk show where somebody pretends that they know something and tells you something that is wrong, and then you believe it and spread it around. So one way to end the disinformation is to go to this CDC site and get the facts. And these are the kinds of things that will help you, your family, and the community in general. We have to keep in mind that this has been a terrible virus. We've had 46,405,253 cases of COVID-19 in the United States. New cases in the last 7 days is 503,000. 503,000 people have taken on the COVID virus and become ill in the last 7 days in the United States. So it's not gone. That's pretty clear. So the total deaths from this virus as of this taping is 752,196. Think about that. That's staggering. That is more than we've lost in wars. So by not taking this seriously, and I mean that, by not taking this virus seriously, we've probably added 200 or 300 or maybe 400,000 more deaths that could have been prevented. So we can stop this spread if you get serious about this. And one of those things you can do is get vaccinated. And you can come up with all kinds of excuses. And I'll tell you, all of those excuses are not as important as you getting vaccinated. And even if there are some risks in getting vaccinated, the risk of dying from COVID is much greater. So anyways, here's a source where you can go for more information. Now, the National Institute of Health has been doing COVID-19 research as cases have developed. And they know that certain people are more likely to have a severe reaction to COVID-19 than others. People with pre-existing health conditions like obesity or diabetes or high blood pressure, for instance, are more likely to have a severe reaction from the virus being in their body. And keep in mind, we have long COVID symptoms that can follow a person for a lifetime. This is more likely to affect men than women, and the risk from dying for COVID-19 increases in age. It's not surprising that all these people age 65 and older are getting vaccinated. They understand the risk factor. They understand that they could die if they're not vaccinated. And so if we can get everybody else to think in that same way, I think we would be much better off. The other thing that we have to keep in mind now is that many employers and institutions of higher education, such as universities, are now requiring staff and students to be vaccinated against COVID-19. And you might say, oh, I have a right to not get vaccinated. People who work with you have a right to be safe in the workplace and not be exposed to COVID. And if you're getting vaccinated makes it possible for that to happen, whose rights are more important, your individual rights or the rights of all the people you work with? The same thing in school systems. You know, there are children, there are young adults who have a right to be safe. If you're vaccinated, they're less likely to run the risk of catching COVID. And we do know that there are some breakthrough cases of COVID even with people who are vaccinated. They're less likely to be hospitalized. They're less likely to die because they're vaccinated. But because you or somebody else didn't get vaccinated and you passed this virus load on to them and it got into their system, they got sick. And they had to fight it off. And even after they fight it off, they may still be ill. So the most recent situation with the federal government is, and with state governments and local governments, is they're requiring vaccinations of employees, and the alternative option is to get COVID tested weekly. And in many cases, employers are saying, okay, you don't want to get vaccinated, that's fine. You have to get COVID tested every week. And the insurance companies now are saying, well, I think you should pay for it. Or we're going to raise the premiums on your employer's health insurance because there's a lot of unvaccinated people working in your environment, so your health insurance costs just went up. The CDC now recommends that children between the ages of 5 and 11 receive the Pfizer-BioNTech pediatric dose. We don't know what the long-term effect of COVID-19 is on brains and hearts and other organ systems, and we won't know for years. We'll do some longevity testing and we'll follow this group of people, and we'll know in 5 or 10 or 15 years what the long-term effect of COVID is. Researchers have found that protection against COVID-19 declines over time. So when you first get the vaccination, the effectiveness might be, let's say, 86, 88%. Over a 6-month period, it's going to drop to maybe 58% or 43%, depending on which vaccination you received. That's why we're asking people to get a booster so that they can build up their immunity again. And more than likely, because COVID-19 is endemic, it's going to be a yearly vaccine, just like we do for flus. And so this is not going away. COVID's going to be with us for a long time because it's in the system. It's now endemic. We're fortunate in the United States. We have all the vaccines that we could ask for. There are places in the world that still haven't gotten any. So COVID-19 is going to be in the population for some time to come. Let me talk a little bit about vaccine research, and then I'm going to ask you to watch a video about vaccine research. But vaccine research has been really innovative. Pharmaceutical companies are working with this new vaccine technology, and the disease targets are even expanding. They're looking at vaccines to deal with conditions like addiction and allergies. Vaccines may become the way forward for dealing with many things that we didn't in the past see as needing to be vaccinated. So be comfortable with vaccines, accept them. They've brought us this far. Before vaccines, the life expectancy of people in many places was 50 years old. Now people are living to be 100. So with vaccinations, we've extended the life of people and also made communities safer, made our urban and rural areas safer. People are living more comfortably, not ill because of vaccinations. So don't turn a blind eye to it and don't act as if it's a bad thing. It is a very good thing. It is a very important thing for you to endorse and support. And if you're an anti-vaxxer, take a look at this differently. Spend a little bit of time looking at the facts and really take a second look at getting vaccinated, because it might save your life and the life of your family members. And I think it's very important not to be political about this. This is not a political issue. This is a health issue. So I'd like you to watch this brief video, and then I have somebody who's going to be a guest and is going to share some important medical information about vaccines after the video.
All COVID-19 vaccines being developed aim to produce immunity to the SARS-CoV-2 virus by stimulating an immune response to an antigen, usually the characteristic spike protein found on the surface of the virus. Some traditional vaccines achieve this by modifying the virus to weaken or disable it, so that when introduced to the body, an immune response can be generated to the antigen, without the virus causing disease. When the immune system comes into contact with the weakened virus, its defences, such as antibodies and T cells, attack the virus or infected cells. In the process, specialised memory cells take note of the specific antigen and prime the immune system to produce cells and antibodies that will quickly target these proteins. So the next time that person is exposed to the same virus, the immune system is ready to fight it off. Instead of using the whole virus, another way to trigger immunity involves using just fragments of it, like the spike proteins. These subunit vaccines have the advantage of being relatively easy and cheap to produce, and are incapable of causing disease because these fragments are not able to infect host cells. However, they are less likely to be recognised by immune cells aimed at attacking infected cells, which means they may trigger a weaker immune response. Because of this, subunit vaccines often include chemical agents called adjuvants, which are designed to stimulate a stronger immune response, and booster shots may also be required. Not all vaccines are designed to introduce antigens to the body. Some work by using cells in a patient's body to produce the antigens themselves. Examples include viral vector vaccines and mRNA vaccines. In both cases, the goal is to get a short fragment of genetic code taken from the target pathogen, in this case the SARS-CoV-2 virus that causes COVID-19, into the patient's cells. By hijacking the cellular mechanisms, these kinds of vaccines mimic the way viruses normally reproduce during natural infection. But rather than creating copies of the virus, the cells only produce large amounts of antigen that then usually trigger a strong immune response. Viral vector vaccines achieve this by inserting the genetic code for the antigen into a harmless virus, which effectively acts like a delivery system to get the code into the cells without causing disease. Vector-based vaccines can be complex to develop, but they can trigger strong immune responses without the need for adjuvants. And in theory, one type of vector can be used to deliver code for a range of different antigens, which can speed up vaccine development. Nucleic acid vaccines, like mRNA and DNA vaccines, also involve inserting genetic code into cells to produce antigens. But instead of using viruses to deliver the code, these vaccines take a more direct approach that involves inserting the code directly into cells, either by attaching it to a molecule or by forcing it into cells using a gene gun. These vaccines can be quick and cheap to develop, but they are a relatively new technology. With hundreds of COVID-19 vaccines now in development, it's likely that a mixture of different approaches will be needed in order to stop the global spread of this coronavirus and end the pandemic.
You learned a little bit more about vaccines. I'd like to introduce somebody next who can provide some additional information, an expert in so many ways. Dr. George E. Cucano, who is the Dean of the Central Michigan University College of Medicine. Fire up chips. Dr. Cucano, thank you. So, Dr. Cucano, it is a pleasure to have this opportunity to ask some questions of you regarding vaccines. And as you know, we have used vaccines in public health. How has vaccines advanced public health in your estimation?
I think, for the years we've had the vaccine, over 50 or 60 years, this is probably one of the best scientific inventions. This is all about prevention of disease, prevention of large outbreaks in the US and globally. I think the scientific breakthrough of vaccine has been a life-saving for the past 50 years.
Okay, so you and I would both agree that this is one of those wonder achievements in medicine. So how do you view the impact of misinformation and the ability of medical providers to go out and do what they're doing? Because we've had so much misinformation about vaccines, particularly in the last few years. What is your thoughts about that?
Let me categorize that differently, outside to COVID. So pre-COVID, back in 2019, back 20, 30 years ago, you had individuals in this country and throughout the world that have been vaccine refusal, that are the anti-vaxxers. These are vaccine refusal. It becomes from a certain ideology, whether religious, cultural, against scientific breakthrough, where they don't believe the burden of the disease is going to be justify the cost of the vaccine. So the anti-vaxxers, as we know them, or the vaccine refusers, have been there pre-COVID. What we're seeing now in this past pandemic, we're seeing people who are vaccine hesitant. And that vaccine hesitancy, this is where the bulk of people are, at least in this country. They come in two categories, if you want to say it this way. Some of them are hesitant yet. I'm going to wait to make sure my neighbor gets it, my parents gets it. I'm going to wait maybe for some time because, quote unquote, they're too new. And you have other vaccine hesitants. Well, I'm not sure about the science, or this is politicized, or this is ethnic. So you have anti-vaxxers. There's little hope to do anything with them. They never get the flu shot. They did not get a tetanus shot growing up. They did not get measles, mumps. That's always existed. The vaccine hesitancy, I'm hoping that we can move as many of them to get vaccinated.
Yes, I would agree with you. So how would you rate this COVID-19 vaccine, or actually there's probably 8 vaccines out there right now, and more that are being made. How would you rate those compared to other vaccines, or just in your history?
Let's not look at the vaccines that are developed overseas. This country, similar to the EU actually, there's lots of rigor for things to get approved by the FDA, to get approved by the CDC. And by the way, for anything that goes through the CDC, Center of Disease Control, they use an outside expert panel. So these are not bureaucrats, these are not government employees, these are people with science, these are people with knowledge and depth and expertise that make these recommendations to the CDC after the FDA have invested them through, and the FDA has also independent panels. What we're seeing with the COVID vaccine, at least the 3 vaccines available in the US, this is the Moderna, J&J, and Pfizer. That's another breakthrough in science. I mean, the RNA vaccines, the RNA science, the RNA vaccines is nothing new. The science has been there for at least the past 30 years. The application of it to use it in individuals' population got accelerated with the COVID pandemic. So it's not like things have been rushed through in a year to get us. So things are not that experimental. The experiments have been done years ago. The application is new. Fast forward, I strongly believe that the RNA science is going to be the basis for more vaccines. So the flu vaccine that most of us take on a yearly basis is going to be RNA-based, hopefully, in the future. There's hope for the RNA science to be a cure or at least a prevention for certain cancers too. So there's so much going to happen around the RNA science, where the tipping point had happened through the COVID. So I have full confidence with all 3 vaccines available in the US. European vaccines, I mean, there's an FDA equivalent in Europe that does the same. I cannot speak up to other vaccines throughout the world.
Yeah. Well, we have the vaccine for children that is now being presented. I know many children have already been vaccinated just in the past few days. What's your thoughts about that in terms of your confidence in it and as a prevention method? And I know many parents have concerns about it. What's your thoughts about it?
You have to believe in science. These things are not rushed through. I mean, these things are done with science. I mean, for the thousands of patients that got enrolled in the 5 to 11 or the 11 to 18, there were minimal side effects. You have to keep in mind, just in the US, we've had at least 2 million kids who got the COVID vaccine. We have hundreds of kids who thousands of kids who end up in the hospital. We've had probably 600 to 700 kids who died from COVID. And what we're seeing now also what we are calling the long COVID syndromes. So people who get the COVID as a disease, adult or children, potentially can have long-term side effects from that. The few side effects we've seen from the vaccines have been transient. I mean, you get sick for a day or for a few days, and you're done. We don't know. I mean, from the studies that happened with Pfizer, soon Moderna to be released, there've been no death from the vaccine, but kids have died from having COVID.
The COVID-19 has certainly put everybody's attention to the fact that contagious diseases are a big deal again.
But this is nothing new. We've had viruses, I mean, throughout the history of the world. We've had bacteria. Fortunately, now we have antibacterials, antibiotics to take care of this. For certain viruses, I mean, HIV or the flu, we have medications. For COVID, we're gonna have medicine sometime soon. So these contagious diseases are nothing new, whether it's the flu, whether it's the measles, mumps, rubella, polio. And the history of viruses in humanity, there's only one human virus that got eradicated. Smallpox.
Yes.
Every other virus stayed with us.
Yeah.
The flu is a virus. We have a vaccine for it every year.
Yeah.
Polio, I mean, where the vaccine has been around for over 50 years. Fortunately, in this country, in the US, we don't have polio outbreaks, but we're still seeing them around the world in developing countries. So the virus is going to be with us. COVID's not going to go away.
Yeah.
The numbers are down. We're coming out from a third surge, but the COVID virus is going to be here.
Yeah. Yeah, what I hear you say is we've been working with viruses and vaccines for a long time, and we'll prepare and be able to work with whatever comes next.
But we're fortunate now we have science to produce vaccines that are effective, that are safe, and soon we're going to have medications. So kudos to the science, kudos to all these researchers to be able to mitigate a pandemic by producing vaccines that quickly, that are safe, that are effective, and by getting at least 1 or 2 medications in the market, hopefully soon.
Yeah, that's really optimistic. I like that. What do you think about the potential of One Health being adopted as a prevention strategy with medical providers?
So for our listeners there, One Health is one initiative from the Center of Disease Control. We're looking at the whole ecosystem. As humans, we're not living alone. We live in an environment. There are environmental factors. You have animals, you have pets. So One Health is an approach to look at the whole ecosystem, how we interact with human, pets, and the environment as it relates to disease. This speaks up how underfunded or under-resourced our public health system is. Yeah. So, we spend 18% on our GDP in healthcare. Many people call it the sick care. Yeah. We spend a fraction on that, on prevention. And I think One Health is trying to look at the ecosystem through an initiative that CDC started, and hopefully it's going to go global.
Well, related to that is climate change, and probably it's going to have some impact on zoonotic diseases because we're going to see changes in the ecosystem. Do we need to be thinking forward about this in a different way and not consider that things are going to be as stable as they were in the past maybe 50 or 100 years?
We don't live in isolation.
Yeah.
I mean, we live with animals, we live in pests. I mean, the effect on the environment has a big impact on diseases, whether infectious disease or others. I mean, look at smog in certain countries, look at pollution, look at smoking, look at transmission of diseases in hot weathers, I mean, water swamps or others.
Yes.
So we have to look at this as a whole ecosystem and figure out what the impact and how we interact.
Do you particularly because you're working with so many students now, do you find that people are more concerned about climate change and looking at it differently than we have in the past?
Actually, everyone is concerned about it, but unfortunately it gets politicized. And this is where things break.
Is there anything else that you can add that possibly is an insight that you have about this whole experience that we're going through?
I mean, COVID-19 is not going away. It's going to have to, people are dying from it. People that get sick. The science is solid, please. I mean, our best mitigation strategy is take that vaccine.
This is probably one of the best vaccines that's ever been developed in our lifetime. So it's important to kind of keep that in mind. And in closing, I just want to say this. Please, think about everybody else in the community, not just yourself. You know, we have to be kinder. We have to look out for one another. And it's not a political thing. Please, don't make it that. You know, and don't push misinformation and disinformation along. You're hurting people when you do that. Your opinion, if it's not fact-based, actually creates the kinds of conditions where people are reluctant to get vaccinated. If anything, right now, we want people to get vaccinated. We want to get this under control. There are countries like New Zealand who have this under control because they've done all the right things. We can be better than New Zealand, can't we? This is America. We're supposed to be number one at everything. Let's see if we can be number one at being vaccinated. Thanks for watching this program. Thanks for listening to A to Zig. Hopefully you're going to be more inspired and maybe more passionate about working together in the community. Have a good day. Take care.